Myself is Dr. Bhatia. I am MD Medicine. I am doing private practice. Today my topic is understanding cholesterol management. Cholesterol is an essential component of the blood, cells and body tissues. Almost every cell of the body needs cholesterol to function normally. Cholesterol is essential for producing hormones, vitamin D and bile acid that helps to digest fat. Our body needs cholesterol to be healthy, but too much cholesterol can be harmful for the health. Body produces all the cholesterol it needs to keep healthy. Body also gets cholesterol from food we eat, which is called dietary cholesterol. Cholesterol is fatty in nature and cannot dissolve in blood, which is watery in nature. So for the circulation in the blood, cholesterol is packaged in what is called lipoproteins, which have a fat inside and protein outside. There are two main kinds of lipoproteins which carry cholesterol in the blood. One is LDL and second is HDL. LDL is low density lipoproteins, which is also called bad cholesterol. And HDL is high density lipoprotein, which is also called good cholesterol. So I am discussing now about LDL. LDL is low density lipoproteins. As it carries cholesterol to the tissues, including blood vessels, most of the cholesterol in the blood is in the LDL form. The LDL numbers needs to be low because higher the level of LDL cholesterol in the blood, greater the risk of the heart disease. If there is too much of LDL in the blood, some of the excess builds up and stuck up in the inner walls of the blood vessels, which causes thickening of the blood vessels and makes them hard. These causes obstruction in the normal blood flow, increasing the blood pressure. High blood pressure results in several diseases such as heart attack, kidney disease and stroke. Second is high density lipoproteins or HDL, also called good cholesterol. As it removes the bad cholesterol from the various organs and tissues it clears from the body, it can also remove excessive cholesterol accumulated in the blood vessels. To remember, the H in the HDL commonly refers to H means healthy. So HDL levels number should be as high as possible so that LDL can be lowered. The other common type of the fat in the body which builds up in the blood vessels is called as triglycerides. They come from the food and body may also mix them. High cholesterol usually has no signs or symptoms. The only way to know whether one can have high cholesterol is to get the cholesterol checked. The healthcare team has to do a simple blood test which is called lipid profile to measure the cholesterol levels, which are as below. One is total cholesterol, second is LDL, third is HDL and fourth is triglycerides. Total cholesterol is the total number of LDL plus HDL levels and plus triglyceride levels. Cholesterol is measured in milligram per deciliter. The desirable level of cholesterol in the lipid profile are as below. Number one is total cholesterol, it should be always less than 200 milligram percent. Second, LDL, it should be less than 100 milligram percent. Third is HDL, it should be greater than or equal to 60 milligram percent, as it is a good cholesterol, so its value should be high. And fourth is triglycerides, it should be less than 150 milligram percent. If the cholesterol is found to be high, the doctor will recommend various treatment options such as dietary and lifestyle changes and medication. Though cholesterol levels can be lowered with the lifestyle changes, many people need cholesterol lowering drugs in addition. Under drug treatment, I am going to discuss the number of drugs which are used to lower the LDL levels. First is statins. They are very effective in lowering LDL levels and are safe for most people. These are considered first line of treatment and also called as initial therapy. Second is bile acid sequestrants. Third is nicotinic acid that lowers LDL and triglycerides and at the same time raises HDL levels. Fourth is fibric acid, lower LDL but are also used mainly to treat high triglyceride levels and low HDL levels. Fifth is cholesterol absorption inhibitors. They lower LDL and can be used alone or in combination with the statin drugs. These are the 5 categories of the drugs used for this treatment. If a doctor prescribes medicine as a part of treatment plan, make sure that take these medicines regularly. In addition to medicines, heart healthy lifestyle changes are also taken care of. Under healthy lifestyle changes, uh, we can take following steps. One is healthy eating. Second is becoming more physically active. Third is quit smoking. Fourth is losing weight. Fifth is managing stress. And sixth is having good quality sleep. These are the 6 lifestyle changes. First, I will discuss healthy eating. Our body makes all the cholesterol it needs, which is why experts recommend that people eat as little dietary cholesterol as possible while on a healthy eating plan. Dietary cholesterol is found in animal foods such as meat, seafood, poultry, eggs, and dairy products. So, what one can do? One is limit foods high in saturated fat, such as cheese, fatty meals, dairy products, tropical oils, and highly processed foods. Second is choose foods low in saturated fat, trans fat, sodium, and added sugars. These include lean meats, seafood, fat-free or low-fat milk, cheese, yogurt, whole grain, and fruits and vegetables. Third is eat foods naturally high in fiber, such as oatmeal and beans, unsaturated fats found in vegetable oils and nuts. Increase intake of fruits, vegetables, whole grain, poultry, fish, nuts, while curbing sugary food and beverages. Second, becoming more physical active. Physical activity is important as sedentary lifestyle lowers HDL or good cholesterol, and less HDL means there is a less good cholesterol to remove LDL or bad cholesterol from the blood vessels. Just 150 minutes of moderate intensity aerobic exercise per week is enough to lower both cholesterol and high blood pressure. Exercise which one can do includes brisk walking, swimming, bicycling, or even a dance class can fit the bill. Third is quit smoking. Smoking lowers the HDL cholesterol and is well known to increase risk of heart attack. By quitting, smokers can cut down their cholesterol levels. Fourth is losing weight. Being overweight or obese tends to increase the bad cholesterol and lower good cholesterol. Reducing the weight for the obese person can lower the cholesterol levels. A weight loss of as little as 10% can help to improve the high cholesterol numbers. Fifth is managing stress. Chronic stress can sometimes raise LDL cholesterol levels and decrease HDL cholesterol levels. And sixth is having good sleep. Sleep helps heal and repair the heart and blood vessels. The recommended amount of sleep for adults is 7 to 9 hours per day. Sixth is good quality sleep. Sleep per day 7 to 9 hours a day is recommended for having good health. At the end, I want to summarize the session. As high blood cholesterol level is one of the major controllable risk factors for heart disease, heart attack, and stroke. No matter your age, you can take steps each day to keep the cholesterol levels in a healthy range. High cholesterol can be prevented and managed by making healthy choices. It can be done by taking the medicine as directed, making healthy lifestyle changes, talking with the healthcare team, and checking the cholesterol regularly. Thank you.